everyone. I've had so many requests from people wanting an update video on where I'm at. So today is pretty much 3 months since I finished treatment and 2.5 months since I got back to Australia. So I thought it'd be a good time to give you an update. I'm not going to go over the stuff that I put in my 1 month post-treatment update, other than to say all those results I'm still seeing. They are all still there, which is great. And if you're interested in that, the video is on the YouTube channel. You can go back and watch it if you haven't already. I'd like to talk in this video more about the new results that I've seen in the past month or so. The timing is really good because at the moment I'm going through reassessment. Every year I have to go through reassessment of all my illnesses to see where we're at for supports. So it works out well that I've had a bunch of tests done over the past 6 weeks or so that we can see the results post-treatment officially through actual tests as opposed to just what I'm feeling as well. I want to start by talking about deterioration because I still have not overall deteriorated since I left Australia for Cyprus in March. That is months ago now, and that is the longest ever in about 15 years by a long shot that I have not deteriorated. So I'm really, really excited at those results. I also have had my first lot of bloods done since I got back from Cyprus. Now, these are not my Lyme blood tests because we know I'm still fighting Lyme. I still have all the antibodies in my blood. I'm not going to pay $1,600 to send my blood to Germany again to be tested at this point in time because we know the results are going to come back positive. These are my regular blood tests that I have done between every month and every 3 months normally. It's my full blood, so workup of all my cells, liver, kidneys, vitamin D, iron, just an absolute batch load of bloods that get done in one hit. Normally on a blood test, I would end up collecting stars. That's what I call it. That means that when your blood test comes back, if something is abnormal, there is a star next to it. If they're really abnormal, sometimes you get a double star next to it. Normally, over the past 5 or 6 years, I would average between 8 and 12 stars with at least 1 double star on every blood test. That's just become normal for me. I just joke blood tests are a chance for me to collect stars. These blood tests, on my standard bloods, I only had 4 abnormalities, including none on my liver and kidneys. That, since I started having bloods done years ago, has never, ever happened. And before anyone says it's just a fluke that it happened this time, I'm going to put my blood file over the video here now. These are all the blood tests I've had done previously. There are lots of them, and I have never, ever seen a blood test that has only come back with 4 stars. So I think I can safely link those results to the treatment that I had while I was away. Next up, I want to talk about my heart. I've had an appointment with my cardiologist since I got back. I have regular appointments with him to discuss where we're at. I had a bunch of tests done leading up to the appointment. I did have a Holter monitor on for 24 hours. I also had an ECG done. Now, the ECG came back with sinus tachycardia, which means a fast heart rate, and we already know that I have that, and I would be very surprised if I ever had an ECG that didn't show that. The Holter monitor also came back consistent for POTS. It showed that every time I stood up, my heart rate went up with it. We have also seen an abnormality on my internal loop recorder. So this is the one that's implanted into my chest. And it's an abnormality that I've never had before. And the report on that showed that my heart stopped 4 times between my last appointment and this appointment. It only stopped for a few seconds, but obviously it's not meant to stop at all. That is a concern that we're going to have to monitor. The first stoppage was before I started active treatment. The other 3 were while I was in Cyprus. But because this first stoppage happened before treatment started, I don't think it was the treatment that made that happen. I think it's probably just coincidence and the fact that it was summer, because I'm always worse in summer. I have not had any stoppages since I got back to Perth, and the plan of attack for this now is just to monitor. At my next appointment, I'm going to have an echo done as well as the ECG, Holter, and all those kind of tests. And we're just going to keep monitoring it to see where I'm at, especially over the Australian summer. So it's not a good thing to happen, but at least I'm being monitored for it. And if it continues, I'm assuming we're going to be having the pacemaker discussion, which we've sort of had crop up before, but we're wanting to put that process off as long as we possibly can. Hopefully we'll never have to have one, but we'll just see what the results come back at. Overall though, the cardiologist is very happy with the results of treatment because I've been able to stop my lunchtime medication. Normally I would take medication at breakfast, dinner, and then most of the time during the day, depending on what my heart's doing at any moment in time. Now, I very rarely have to take that lunchtime medication. And that's the first time in 3 or 4 years that I've been able to say that. So we think we're finally starting to see some cardiac results as a result of the treatment. Physiotherapy-wise, as I said, I have had a bunch of assessments done, and there's an assessment that they do every time I have this process, and it's called a Berg test, and basically it determines your fall risk. I always do really badly on it. The standard test results are out of 56, and I believe if you are under 40, a walker is recommended. If you're under 20, a wheelchair is recommended. This time I scored 12 on the test. Now, I know that sounds like a really bad result, and it is a really bad result. It's not great. My physio couldn't believe how excited I was at getting 12 because he's never seen someone that excited over that score. But where I did get excited was normally when I have that test, it's always worse than the year before. I think we started the first time I had it at about 19, and it's just every year got worse and worse and worse. Last time I had the test, it was 11, which means this time we've gone up. Yes, it's only by 1, but it's an increase, not a decrease, and I will take that as a win and a positive because I don't get to have those very often. So seeing that increase in score, even by only 1 point, was great. I have also had a podiatry reassessment done. Now, anyone who's been following me for a long time knows that my legs are really bad, to the point the universities actually use them as an example for their students of things that can go wrong with someone's legs. Now, the reassessment did show that on both legs now, I have what's called a herniated muscle, which basically means the muscle in my leg has kind of exploded in the leg and burst. So they think that is repetitive, that has built up over the past 15 or so years, and that my legs have just finally had enough and can't handle the way I walk anymore. At the moment, it's causing me a bit of pain, but it's not significant pain. So we're going to leave it for the time being because the surgery to correct it would be so brutal. We don't want me to have to go through that unless I absolutely need to. Other than that, though, every assessment I've ever had with podiatry for the past 7 or 8 years, I have got worse, and significantly worse every time. You can just see the deterioration. My podiatrist this time was really happy because it's the first time I've had an assessment and I haven't significantly deteriorated. My legs are still not normal. They're still really, really bad. All the test results indicated that. But to have halted that deterioration in my legs is a big thing, because obviously it means I'm still walking and still able to get around. So I think that is a lot to do with all the rehab work and all the focus we put on my legs while I was in Cyprus to try and build up the strength in them. I think I'm starting to see those results come through now. Now, fatigue, as you know, has been an issue for many years. And the fatigue at the moment is quite bad. That is my own fault, because I'm very, very careful when I go out places to calculate what I'm going to do and work out my rest time accordingly. So for example, if I know I'm going out, say on a Saturday night to someone's birthday or something like that, I would rest the 2 days before and the 2 days after to make sure that I can handle that night out. My body can handle that night out. I've been doing that since I got back and have been really frustrated because I've still been getting tired. Then I realized, it was pointed out to me by a fellow patient, that I haven't taken into account properly all the rehab work I'm doing and the physical toll that is taken on my body. And that's probably why I'm so tired. Because I've been doing the rehab at home, I just haven't thought about the fact that it is so physically intense because I'm not leaving the house. So I haven't been counting it as a day out, when in reality I should have been. So I've adjusted that program now. I'm doing one rest day, one slow day of rehab, then one bigger day of rehab, and doing that continually and taking it in turns. And that seems to have been much better now on the fatigue levels. But I know there's a lot of people watching this who are on their way to Cyprus or about to go on their way to Cyprus for treatment. And I just want to say, when you come home, make sure you're structuring that rehab and allow for the fatigue that the physical toll of the rehab causes, because that's really important. It's something I probably didn't do enough of at the start. I've cottoned onto it now and really starting to focus on that to make sure I get the most out of rehab without it turning it into a negative. The other thing I'm still noticing a big difference in is the passing out, because I'm definitely still not passing out as much, and the cardiologist was very happy with those results. I'm starting to get a little bit better at recognizing my warning signs again, starting to get a new grip on what my new reality is and being able to work that out a bit better. So that's a plus. So that's a bit of a rundown. As I said, all the 1 month treatment results that I put up, I'm still seeing as well. Overall, I'm very happy with the results of treatment. For me, it was 100% definitely worth me going, and I will keep you updated as I go through in time, because I know there's a lot of people wanting to see the long-term results as well. Coming up, I've got a couple of things happening. I am booked in for surgery on the 25th of September to have my bladder procedure done. That for me is a regular thing. I have that done twice a year to keep my bladder working effectively. So I'm booked in to have that done. I have a few bigger things coming up, like I'm judging Westpac Scholars later on this month. I do that every year, and it'll be interesting to see how my body goes this time, because normally it knocks it around a bit. So I'm really curious to see how I go concentration wise with that this time round, and basically just settling back into Australian life. I found the adjustment back in very hard, but taking things one day at a time still, and hoping that we'll continue to see results. As always, I know there's a lot of you going, to Cyprus who have been messaging me asking questions. I'm always happy to answer the questions that you have before you go, while you're there, after you get back. So please feel free to contact me if you have any of those, or comment them below. Finally, I'd just like to say a thank you to everyone who's been following my videos, liking them, commenting, subscribing. Also those of you who have messaged me to check in, or who have come to visit to see how I'm going since I've been back. I really appreciate all your support.